You're listening to a podcast from Young Lives, a longitudinal study of poverty and inequality. Since 2002, we've been following the lives of 12,000 children into adulthood in Ethiopia, India, Peru and Vietnam. We've just published the results of the 7th survey in our long-running study, and I'm delighted to be joined today by Young Lives Director Marta Favara, who's here to tell us all about it. Welcome, Marta.
Thank you, Julia. I cannot believe the day has finally arrived, and we have been looking forward to this moment for so long. So today, I'm very happy to share with you the key findings emerging from the new data we collected in round 7.
Fantastic. So Young Lives has been running for more than 20 years, which is incredible. Before we turn to what you found out in this latest round, can you just start by reminding us what the study involves?
Sure. Young Lives is one of the longest-running longitudinal studies in the Global South, and it was designed to monitor how the lives of children growing up in poor communities were changing over the 15-year course of the Millennium Development Goals. The study has followed 2 cohorts of children, age 1 and 8, back in 2002. To date, we gather 7 rounds of quantitative data, 5 or 6 rounds of qualitative data, depending on the country, and 2 rounds of school survey data. In round 7, we weren't able to conduct the survey rounds in Vietnam. So far, we have built a formidable data sets and research evidence, and what is best is that all the data are compiled and ready to be used. As you said, we just completed round 7, and I'm very proud of what we achieved. We have been able to interview over 80% of the original 2001 sample, and this is a remarkable result if you compare the attrition rate of young lives with any other longitudinal study. And for that, I'm very grateful to our country teams and field workers for the massive effort they made. They have been working in the field between 6 to 9 months, and they have often had to travel to remote communities. They did not give up in locating our respondent, despite the increased internal and international migration, and despite the additional challenge in those regions that were affected or still affected by the conflict in Ethiopia. And they have been adjusted the fieldwork logistics to try to accommodate young people's busy schedule now that they are no longer kids, they are young adults, they have jobs, and they have family to take care of.
So it's an enormous effort for many people in getting round 7 concluded. So I'm just thinking that as the children have grown up, I imagine that the sorts of questions that you've asked them over those rounds you describe are different now than those that you asked them when they were little.
And you are very right here, Julia. Yes, we have some key questions that we ask in each round to make sure that we have comparable measure over time. For example, when we talk about or we ask them about their education, learning skills, family lives, employment, and others. But yes, you are right saying that. So through the rounds, we have adapted our survey questionnaire to respond to the change in young lives, people's life and experiences as they grown up from children through adolescence into young adult they now are. And we take into account policy priorities as well, and we listen to the demand. We try to contribute to the national and international debates. And we look into where there are gaps in the literature and where Young Lives has a value added and we can contribute to. Over time, we remain faithful to our key mission, the key mission of the study, which is to deliver policy-relevant research to improve lives of disadvantaged children and young people in the Global South.
So turning into the details a little bit of round 7, was there anything that you introduced for the first time? What was new in your survey in round 7?
We introduced a number of additional survey modules. I would like to focus on 2 innovative survey components in particular. One of them is a new tool that we use to collect sensitive information. So, for example, to collect questions or to ask information about being a victim of intimate partner violence or the young people risky behavior or their experience of the recent conflict in Ethiopia. And we do that through a self-administered questionnaire. The way we do it in each one of the country is quite different. So in Peru, for example, we ask the respondent to read and respond to the question by themselves using a tablet. While in the case of India and Ethiopia, we recorded those questions. So instead of reading, they listen to a simplified version of the questionnaire that we administer in Peru. And this is very, very important, specifically in those contexts where literacy is quite low. as the respondent would struggle to read and complete the questionnaire by themselves. And the other component which is new, it's a way of gathering further information on mental health. We saw that it's quite important to do that, and we saw the dramatic effect of the crisis and the COVID pandemic. So for the first time, we collect air sample to extract information about cortisol. So why cortisol? Cortisol is a very good indicator of stress. But what is interesting for our study is that the body tends to react if we have been exposed to challenging circumstances early on in life, and the body overreacts, meaning that the body has a memory and reacts based on those memories. This is going to provide a lot of insight on mental health and the long-term impact of being exposed to shocks during the life course, or not least in relation to climate change and the increase in frequency and intensity of environmental shocks.
And this you can find from taking hair samples. It's fascinating.
Yes, it is.
Thinking about the thousands of interviews that you've carried out in round 7, you must have gathered a huge amount of data. So what have you published now? What are the findings that you are publishing now from that data?
We have distilled the data that we collected in round 7 into 9 short fact sheets, which is what we are publishing now. So we have 3 fact sheets for each one of the country, and they are thematic fact sheets. So one of them is on education and skills, a second one is on nutrition, health and well-being, and the third one is on work and family lives. So in the fact sheet, we take advantage of the unique dual cohort of the study to present how experiences have changed over time between the 2 cohorts. So we compare the experience of the younger cohort, now aged 22 years old, with the experience of the older cohort at the same age in 2016 when we administered round 4.
That's great. We'll turn in a moment to some detail of the important things that you've found out and that's in those fact sheets. First, I just wanted to ask you about the big picture. So, as you said at the start, Young Lives was set up to track progress towards the Millennium Development Goals, of course now the Sustainable Development Goals. And I just wondered, what can you say that round 7 tells us about how and indeed whether young people's lives are improving? Are we on track to meet those goals?
Well, obviously the study countries are all very different, and there are differences even within the country itself and across different groups. Our findings show that whilst there has definitely been progress in some area, for example, in nutrition and education, many aspects of young people's life fall far short of the ambition of Sustainable Development Goals. And our longitudinal evidence shows that being born into disadvantage affects later life outcome in a whole range of ways, from the amount of education completing to jobs and family lives. For example, we clearly see persistent inequalities, and vulnerable groups are still being left behind. So, for example, children born in rural environment, in poorest family, or from certain minority ethnic groups or castes have less access to education, health, and other services. And gender differences, which we saw first open up in adolescence, have widened further as our participant has grown into young women and men. And why we saw improvement over the past decades, we found that young people's lives have been increasingly affected by multiple shocks, including COVID, conflict, and the climate environmental shocks. We saw that young people can be resilient. We saw a recovery since the pandemics, for example, in employment, well-being, and returning to education, but they are not all equally resilient. And we saw that those shocks have the greatest impact, including on mental health, well-being, and food and job security on those least able to withstand them.
Thank you, Marta, for taking a step back from the detail, but I'd really like to turn into that now and just ask you for your key findings from round 7 that you'd like to highlight for our listeners today.
Let me start from what we found about young people's health and well-being. The first clear and worrying finding is that malnutrition continues to be a significant challenge in each country, even though in different ways. So in the case of Ethiopia, an alarming number of young people, about 23%, are still underweight, and despite the progress that we saw happening in the last 2 decades. In the case of Peru, we found a rapid increase in overweight and obesity, and we have roughly 41% of the sample that are either obese or overweight. And in the case of India, we saw a combination of the two. so with a high incidence of both underweight and overweight and obesity on the other side. The second really striking finding is around food security. We found that very many young people are living in households that are food insecure. And what that means in practice is that they don't have food on a regular basis, or they have to eat smaller portion or cheaper staple food with a poor nutrient intake. And this is most severe in the case of India. Obviously, the pandemic and other shocks, including the drought and the conflict in Ethiopia, have certainly played a role here. And finally, our finding on young people's mental health. In round 6, we found that many experienced symptoms compatible to depression and anxiety, and this was largely due to the effect of the pandemic and the conflict in the case of Ethiopia. In round 7, young people's mental health continued to be impacted by those shocks and crises. In Ethiopia, for example, we found that anxiety had increased significantly among respondents in those areas affected by the conflict. And in Peru, the burden of mental health conditions remained significantly high, with women suffering more than men, both here in Peru than in India.
Certainly a sobering picture that's emerging from your data, Marta. And it sounds like young people that you've been talking to have a lot to cope with, a lot of challenges to deal with. Can you just talk us through how you see them managing?
Sure. And yes, you are very right here, Julia. So we asked them what they are doing now. We asked them whether they are working, whether they are employed or they spend more time in the house, what sort of household responsibility they do have, whether they are studying or whether they are combining both. We know that they have established family, set up new homes, and most of them are actually working. And the good news is that more young people than in the previous generation are completed secondary school and are now going into higher education. However, there are some buts, and let me mention a few of them. So in the case of Ethiopia, only a quarter of young people have completed secondary school, which means in the Ethiopian context, completed grade 12. And we observe a decline rates of university enrollment. We also saw that early life inequality predict education outcome, particularly school grade completion by age 22, and as well as higher education enrollment. And we saw that participants born in wealthier family achieve better education outcome, which confirms the inequality story emerging from round 7. Overall, despite the increase year in education, we are not seeing this to translate in better job. Most of young people who are in work have poor quality job. In most of the cases, they are in informal jobs, they are poorly paid, they are employed long hour, or they have to combine more than one activity. And almost half of the young workers in our study are not satisfied with the job they are doing. Finally, we found that over the life course, intersecting inequality perpetuate early life disadvantages. And for example, women who married early or have child at early ages, who often come from the most vulnerable socioeconomic backgrounds, they present the lowest education outcomes across the 3 countries. Good news here is that while early marriage and motherhood rates remain prevalent, particularly in India and in Peru, they have decreased over time.
Some encouraging news, but obviously some deep inequalities that continue to prevail for the young people in our study. Actually, as you were speaking, I had a lot of questions emerging from what you were saying and some of the very stark findings that you shared, not least around the levels of malnutrition you discussed and how that is a varying picture across the 3 countries, and also around food insecurity. So what is the plan sort of to look at some of these things in more detail?
Yeah, as you said, these are preliminary findings from round 7, and we will be taking a deeper dive into the data to find out more. We will be sharing the findings with policymakers in our study country over the coming month. And we are also very busy building our new research hub. The hub is investigating the long-term impact of climate change, environmental shocks, including drought, flood, the rise in temperature, and increase in air pollution in low and middle-income countries, which obviously is going to have very important policy implications. And finally, we are fundraising for the next survey rounds so that we can follow the younger cohort right through to 30 years And we will be able to complete the trajectory birth to 30, aligning with the culmination of the Sustainable Development Goal in 2030.
That sounds fantastic. Thank you so much. And what should people do to find out more now about Young Lives?
Well, the best way to keep in touch is to follow us on the social media channels, to head to our website and stay tuned.
Fantastic. Thank you so much. And just in case you want to head to our website, you need to go to www.younglives.org.uk. Thank you so much, Marta, and good luck.
Thank you.